study congenital abnormalities, the abnormalities present at the time of the birth of the baby. Congenital anomaly, congenital abnormality, congenital malformations, and birth defects. They means the same. They are synonyms. The science of these abnormalities is known as teratology, and the agents or the factors which cause these abnormalities, they are known as the teratogens. So the structural, metabolic, behavioral, and functional disorders which are present at the time of the birth of the baby, they are known as the congenital abnormalities. These are the leading cause of infant mortality and account for 21% of the infant deaths. All races and all regions, they are affected indiscriminately, meaning thereby they are present, they appear, they are noticed in every part of the world, in every race. They affect 2 to 3% of all live born infants all over the world. See a few of the defects which are present at the time of the birth of the baby. Look at the shape of the head, shape of the skull, eyes, see the face, and see the face. So these are a few of the pictures which you can see in your neighborhood or around yourself when you walk in your daily walk life. Look over here, a baby born with one of the limb absent, and the baby born with limbs present but not properly formed. This is amelia absence, meromelia partially formed or not properly formed. There's a picture which you might see in your internet search. A gentleman without upper limbs and without properly formed lower limbs, but has grown up to a level when he reached to the university, and probably he has done his PhD in some subject, and now he moves around the world and speaks at various gatherings and functions, motivational speeches he delivers. Another face of the baby born with a mother who was in the habit of drinking alcohol. So the face of the baby is that the palpable fissures are narrow, epicanthus, this one that is present. The mid face is rather flat. Absence of or indistinct philtrum and thin upper lip. Look over here. And narrow chin and minor ear defects like this. And these are the few of the abnormalities which you see in babies produced by the mothers who are in the habit of drinking alcohol, and such a face is known as the facial alcohol syndrome. Another picture in which a baby is born with two arms. This one. And the third abnormality is that he has got only one teeth. You will see in your surroundings few cases which are special face like this, flat face, low bridge, palpebral fissures, oblique, epicanthus, and you may go around the world and this sort of face, similar face, you notice in everywhere around the world, a similar face, Down syndrome. Down syndrome, we'll discuss. A single simian crease, characteristics of Down syndrome. Now a little detail, how birth defects they represent, they exhibit. How do you notice? Birth defects may be structural, a change in the structure, like a specific body part is missing, but if it present, but not formed correctly. So structural defects may show as a part missing or malformed. It may present as a metabolic defect when there is an inborn error in the body chemistry due to a missing or incorrectly formed enzyme. So, birth defects may exhibit in two shapes, structural defects and metabolic defects. Structural defects are visible and metabolic defects are not visible. They are to be noticed when you do blood chemistry or body chemistry. Now, which are the major structural birth defects? Heart defects are very common. Defects of the spine, spina bifida, and defects uh, of the opening of the external urethral meatus in males, instead present at the tip of the male organ or the penis. The external urethral meatus is present on the ventral aspect of the penis. This is known as a hypospadia. The external urethral meatus is not at the tip, but somewhere short on the shaft closer to the root of the penis. That is known as the hypospadia. Major metabolic defects, as told earlier, they are not visible abnormalities in children. Such defects may be harmful or even fatal. They affect 1 in 3,500 babies. For example, phenylketonuria affects the way as the body metabolizes our proteins. What are the causes of the birth defects? They are genetic, environmental, or unknown factors. Genetic factors, as chromosomal abnormalities, they cause 15% of the cases. Environmental factors, they cause 10% of the cases. And combination of both, they cause 20 to 25% cases. But an alarming factor is that 40 to 60% cases are noticed without any known cause. So majority of the cases are noticed where you cannot find any genetic, environmental factor, etc. causing the defect. Genetic factors. They are due to the abnormalities of the chromosomes. Chromosomal abnormalities where the number of the chromosomes specified is not present. The chromosomes, they are structurally abnormal, and at the spot mutations in the chromosome at certain levels, what is called the genetic mutations. The genetic factors may be due to numerical chromosomal abnormalities, structural chromosomal abnormalities, and the gene mutation. Genetic factors. So an error may occur during the formation of an oocyte or a sperm that can cause a baby to be born with too few or too many chromosomes, or with damaged chromosomes. Let's see numerical chromosomal abnormalities, where the number of the chromosomes is different. They result from non-disjunction of the homologous chromosomes in the first meiotic division of the gametogenesis. Therefore, finally, one of the gamete has 24 chromosomes and the other has got 22 chromosomes. Such gametes, on uniting with normal gametes during fertilization, would result as trisomy, that is Down syndrome, an extra chromosome is present, Klinefelter syndrome, that is again an extra chromosome is present, monosomy, when one chromosome is absent. The risk of numerical chromosomal abnormalities causing birth defects increases with the age of the mother. So the babies born to the mothers at a later age, say at the age of 35 or 36 or 40, they are more likely to be having abnormal chromosomes and therefore abnormal births. The structural chromosome defects, they are as a consequence of breaks in the chromosomes due to the invasion of the viruses, to the exposure to the radiation, or exposure to the drugs. What they cause? They cause translocation of the broken segment of the chromosome to some other chromosome, or their complete loss, known as the deletion. So one of the abnormality noticed in the form of a syndrome, Cry-du-Chat syndrome, that result from deletion of the short arm chromosome number 5. Such children born, they have a cat-like cry, they have got mental retardation and heart defects. Gene mutation, a change in the structure or function of a single gene, may also cause birth defects, and like inborn errors of metabolism, for example, phenylketonuria, homocystinuria, and galactosemia. And this accounts for 8% of the all human birth defects. Environmental factors, what they are? They are chemical agents, infectious agents, ionizing radiations, hormones, nutritional deficiencies, heavy metals, and vitamin A embryopathy. Various pharmaceutical agents and industrial products in daily usage can lead to a number of birth defects. A few of the agents are associated with certain birth defects. Thalidomide is a drug which used in the past as an antiemetic drug. Antiemetic means to prevent emesis, to prevent vomiting, to the pregnant woman in the earlier weeks of pregnancy usually suffer from early nausea and vomiting when they rise up from the sleep. So a drug was introduced in the past to prevent that early morning nausea and vomiting. That was known as the thalidomide. So the pregnant woman who used that thalidomide, they came up with the babies with total or partial absence of their extremities, known as amelia or meromelia. Total absence of limbs, that is amelia, or partial absence of limb, that is known as the meromelia. You have seen the picture in the early slides. Anti-epileptic drugs. These are drugs which are used to combat uh, epilepsy, in which the person is suffering from tremors, wild tremors, very gross tremors. So, the use of antiepileptic drugs during pregnancy, that can cause craniofacial and neural tubal defects like the cleft lip, cleft palate in the region, and anencephaly uh, and hydrocephaly. These are the craniofacial defects, and these are the neural tubal defects. Use of tranquilizers, that can cause cleft lip in the babies. Antihypertensive agents used during pregnancy can cause growth retardation in the newborn babies and even fetal death. Aspirin, if used in large doses during pregnancy, that can cause birth defects. Alcohol can cause fetal alcohol syndrome in the babies, characterized by short palpebral fissures, mid-face flattening, that is maxillary hypoplasia, indistinct philtrum, and a thin upper lip, small chin, and additionally heart defects and mental retardation. Cigarette smoking by the mothers can cause growth retardation and premature births. If the mother suffers during pregnancy by rubella virus, the baby can have cataract, deafness, and heart defects, etc. If the mother is infected by varicella virus, chickenpox, that can cause muscle atrophy, mental retardation in the newborn babies. HIV, human immunodeficiency virus infection to the pregnant mothers, can cause AIDS, that is acquired immunodeficiency syndrome in the newborn babies. Hyperthermia, whether man-induced or induced by some disease, that can cause mental retardation, anencephaly, spina bifida in the newborn babies. So the temperature of the body of the pregnant mother by all means should remain at the optimum level, not very high temperature. The high temperature can cause these birth defects. Ionizing radiations. If the mother is exposed to the X-rays or nuclear explosions, can cause spina bifida, cleft palate, microcephaly, and the limb defects in the newborn babies. Various hormonal exposures. Various hormones caused by mothers during pregnancy can cause birth defects. For example, testosterone or norethistone or synthetic progesterone used during pregnancy can cause birth defects. Oral contraceptives, birth controlling pills, have low teratogenic potentials. Oral hypoglycemic agents, long-term use to control maternal diabetes are accounted for teratogenic effects. Insulin, however, is believed to be non-teratogenic. Nutritional deficiencies, poor nutrition of the mother during and prior to the pregnancy can cause babies to have low birth weight and even birth defects. Heavy metal exposures, fish of waters polluted with certain industrial wastes, they have high mercury level. Similarly, pesticides have effects in the crops, and those fish or crop used by the mother can secondarily affect the embryos with cerebral palsy, etc. Overuse of vitamin A as a supplement in pregnancy is very harmful. Isotretinoin, which is an analog of vitamin A, is prescribed for cystic acne by the dermatologists. It is highly teratogenic, can cause mandibular hyperplasia and low small ears in newborn. So, if a pregnant woman is affected by a bad-shaped acne, please do not prescribe isotretinoin or the vitamin A analogs. They are highly teratogenic. So, see the Down syndrome, trisomy 21, 21 chromosome or 21st chromosome has got 3 members instead of 2. So have short stature, flat nasal bridge, epicanthus, tongue protruding, small teeth, short broad hands, hypotonia, mental retardation, and congenital heart defects. Klinefelter syndrome, 47 chromosomes, 1 extra, tall structure, long arms and legs, gynecomastia, male, but the mammary glands are of the shape of women. That is called the gynecomastia. Voice high pitched. Female pubic hair profile. In females, the pubic hairs are down, but in males they are a triangular shape just below the umbilicus. They are hairs, but here they are no hairs in this infra umbilical region, and they are confined to the suprapubic region only, as in case of the females. An atrophy of the testes. Testes are not properly formed, they are reduced in size or almost absent. Turner syndrome, monosomy, one chromosome is absent. Stature short, neck webbed, nipples widely spaced, look, genitalia not very well developed. She is suffering from primary amenorrhea, meaning thereby she does not bleed monthly. Congenital renal defects inside the abdomen and the abnormalities of the aorta in the chest or in the abdomen. Phenylketonuria, that is a metabolic genetic disorder characterized by deficiency of a hepatic enzyme known as the phenylalanine hydroxylase. This is an enzyme on the pathway for the metabolism of the phenylalanine to tyrosine. When phenylalanine hydroxylase is absent or deficient, phenylalanine would accumulate and would be converted into phenyl pyruvate instead of tyrosine, and would be excreted in urine. High levels of phenylalanine are toxic to the brain. They cause mental retardation, brain function abnormalities, microcephaly, short head, mood disorders, irregular motor functions, and the behavioral problems. So we'll go quickly what a list of the agents associated with human malformations. Infectious agents like rotavirus, cytomegalovirus, herpes simplex virus, varicella virus, HIV virus, toxoplasmosis, syphilis. Physical agents, X-rays, hypothermia, chemical agents, thalidomide, aminopterin, warfarin, diphenylhydrantoin, valproic acid, methadone, lithium, amphetamines, etc. Chemical agents, drugs, ACE inhibitors, cocaine, alcohol, isotretinoin, industrial wastes and solvents, organic mercury, lead. Hormones, androgenic agents like testosterone, norethistron, they cause masculinization of the female genitalia, that is the fused labia, clitoral hypertrophy. Diethylstilbestrol, malformation of the uterus, uterine tubes, upper vagina, vaginal cancer, malformed testes, maternal diabetes, heart defects, and neurotubal defects. Now, lastly, how to prevent birth defects. Simple rule: avoid drugs during pregnancy, stop taking alcohol during pregnancy, stop smoking, don't take vitamin A unnecessarily or extra usage. During pregnancy, if there is a history of birth defects like spina bifida or the neurotube defects, anencephaly, etc., to prescribe folic acid that has been prescribed with positive effects in such mothers who have the history of producing babies with absence of head, monster babies, or their defect in the spine at the lower level. How do you diagnose these defects? By ultrasonography, and encephaly is visible, left lip. Heart defects are also noticeable. Maternal serum screening. Alpha fetoprotein is produced by the fetal liver. It leaks into the maternal circulation. Its level is high in fetal neurotubal defects in case of uh, mothers having babies with these defects. If the babies have got neurotubal defects, their level of alpha fetoprotein would be high. Amniocentesis. You draw by syringe the amniotic fluid, and you can detect genetic disorders like trisomy, monosomy from the analysis of that amniotic fluid. Chorionic villus sampling. If you can remove some of the chorionic villi, though you can also notice chromosomal abnormalities from there as well. With this, we reach at the end of our lecture, and I hope if you study this properly, you are able to define congenital abnormalities, what are teratogens, what is teratology, what are the structural and metabolic defects. You can list genetic and environmental factors causing birth defects. You can describe how birth defect can be diagnosed before birth and what are its preventive measures. You can also give examples of a few birth defects. Thank you very much indeed. Please download and study from the book. I hope if you do it, you will learn many things. Thank you very much indeed. Jazakallah.